Hello everybody, I'm Dr. Anthony DeMaria. This is Dr. Casen DeMaria, and this month we got questions on one of our favorite topics, Dr. Casen.
We did.
Chiropractic. So many of you submitted questions and had different things that you wanted to find out about chiropractic care. So we're happy to have a discussion a little bit about that. So how about, Dr. Casen, what is chiropractic care, simply for those that are unfamiliar with chiropractic?
So it's kind of funny because when people come into our practice, it's interesting. They make a chiropractic appointment sometimes, but they don't really understand the big idea of what we work with. So as chiropractors, we work with the nervous system. So the brain sits in the skull, it travels down as the spinal cord, and then all of these delicate nerves come out of those small holes in between your spine. Now, we do work with the spine to help to improve function, and if your spine's out of position in any place, that can impact the nervous system, which controls whole body function. So as chiropractors, we work with the spine, but also the brain and the nervous system, which truly is the lifeline of how our body works on an everyday basis.
I think that goes into maybe what the biggest misconception of chiropractic is, Dr. Casen, is as it pertains to, we'll call it the P word, or pain. Most people seek out chiropractic care maybe initially because they have a pain syndrome, whether that's neck pain, mid-back pain, low back pain, headaches, shoulder issues, knee issues, ankle issues. Those are all things that we help as chiropractors, but essentially it comes back to what Dr. Casen said. It's a communication issue within the nervous system that's causing a disruption with the ability for your brain to understand pain signals in the body. So we do work with people that have pain and it improves, but that's only a small portion of what it is that we do, because most of the nerves in the body actually don't sense pain, Dr. Casen. So there's times where people are getting adjustments, and the adjustments are helping to support their immune system, their endocrine system, their digestive system, even to the point where someone gets up off the table and they can breathe better. So chiropractic is really about optimal function within the nervous system. So I see this quite a bit sometimes too, Dr. Casen, is what are the benefits of getting adjusted? And then on the flip side of that, what is maybe going to happen to someone that doesn't get adjusted?
So benefits. So what I want you to think about is right now, it's amazing. Our heart is beating, our lungs, our brain. So I want you to think of when your nervous system is healthy and strong, better clarity, energy. I think the most common thing we see in our practice is better bowel function. So how many of you would love to poop better? And you should be going 2 to 3 times a day. I think that's the biggest thing we see with chiropractic care. Now, of course, you think about headaches, migraines, neck discomfort, low back issues. We do see a lot of knee challenges and knee issues and shoulder issues in our practice, and it's really interesting because the nerves in your neck go into your shoulders and the nerves in your lower back go into your knees. So maybe you've had prior surgeries like hip surgery or lower back surgery or shoulder surgery, knee surgery. I think that's also one of the misconceptions is if you do have prior surgeries or even a scoliosis, maybe you've been told that you cannot receive chiropractic care. And I think that's also why it's really important, Dr. Anthony, of the types of evaluations that we do in our practice. So those are many, many benefits. What was the other question?
What happens for those that might choose not to get chiropractic care? What are some of the things that they might see if they aren't getting adjusted?
Some of you right now, you have parents or grandparents that have degeneration or arthritis in their spine, and that did not happen overnight. Arthritis happens in a joint space that's not moving optimally. Also, if you have poor posture, and you might not even be aware of your posture, and that's why we do pictures, and even if you're watching us at home, take a side view picture of you and a front view. Do it as a family. That's kind of a fun activity that we encourage our members to do. But if you have that forward posture over time, that will lead to other challenges, whether it's headaches, numbness and tingling in your arms or your hands, degeneration, heart issues. We've had people with forward head posture because their head weighs 12 to 15 pounds over time. That can lead to heart or cardiovascular issues also, Dr. Anthony. So I want you to think of that bigger picture, that it's truly about prevention and being proactive rather than waiting for something to show up. And I know one of the questions that we got this month was, can I see a chiropractor if I don't have pain? And why would I seek out a chiropractor if I don't know that I need a chiropractor?
You know, that's probably one of the most common questions, and how I answer it is, the absence of pain doesn't mean good function. I had 2 people in yesterday, both had lower extremity challenges. One slipped in a hospital, the other was walking out their house, and they didn't necessarily have pain, but what happened was it changed the mechanics of their ankle knee. And like the old song says, the one bone's connected to the other bone, and it can throw things out of position, and then over time you have a new challenge. So even if you don't have pain, getting adjusted helps to balance out your brain and your nervous system and your spine so that it works better. So many of you are getting adjusted, but there could be someone in your life that you know could benefit from chiropractic care. I'd encourage you, if you're local in the Northern Ohio area, come and check us out at the Drugless Doctors. If you're not in the local vicinity, check out a skilled chiropractor. I always encourage people to send their friends and family to alumni of the university that we went to called Life University in Atlanta, Georgia. I know that they have great chiropractors that went to that place.
And we also know a fantastic chiropractor in Naples, Florida. So if you are traveling and you want to go to see Dr. Bob, he's in his Naples practice, and we'd be happy to help take care of you. I know some of the other questions, Dr. Anthony, that I didn't want to skip over here was, can I see a chiropractor if I'm pregnant? And what type of chiropractic do you do at the Drugless Doctors?
So how about, yes, you can get chiropractic care when you're pregnant, and we encourage that. Dr. Casen and I have an advanced certification with the ICPA, the International Chiropractic Pediatric Association. At any one time, we'll see a number of pregnant ladies in our practice and lots of kids. The great question is, what type of chiropractic do we practice in our office? Well, we use drop tables and do simple adjustments in prone and supine position. We also work with people with extremities, work with people with nutrition. We are a well-rounded group that helps make sure that our practice members are at their peak performance. So I hope this information on chiropractic serves you well. Tell your friends and your family if they aren't getting adjusted that they should, and you'll have a great day.
Bye.